Wellness Wednesday, and as we do wrap up American Heart Month, we are focusing on something simple that can make a big difference. So the food we eat can have a big impact on how we feel. This morning, we're breaking down the best and the worst choices for your heart. And joining us this morning is Dr. Romia, a cardiologist with Honor Health. So thank you so much for being here.
Good morning.
Okay, so let's start with the positive, okay? What are the top foods you would recommend for us for better heart health?
When it comes to cardiovascular health, the big things we talk about is the Mediterranean diet, the DASH diet.
Yeah.
I have some examples in front of you. Diet that rich in fatty fish like mackerel, salmon, things like fresh fruits like berries, nuts, legumes, and leafy greens, spinach, kale.
Yeah, good grains too, right? And you know, here's the thing. None of this is like reinventing the wheel. We've heard about the Mediterranean diet, the DASH diet for so long and the heart benefits to it. It's a hard thing, you know, sticking with it. We hear a lot about omega-3s. Why are fatty fishes so important, so good for us?
They are rich in omega-3 fatty acids.
What does omega-3 acids do for us?
It reduces your LDL and raises your HDL levels, so it improves your cholesterol.
Okay.
And improving cholesterol does prevent heart disease.
So my mom loves raspberries. I don't know, great antioxidants, other berries too, right? The blueberries, the strawberries, and leafy greens. These all work together to really help us out here. Why are they so powerful and good for our arteries?
Because antioxidants do fight atherosclerosis, which is the biggest risk factor for heart disease and heart attacks. So implementing these in your diet, adding them in addition to everything else we talked about.
Yeah, for sure. So what I noticed here today, I was just telling you guys, is that, okay, we've got the greens, we've got the good. What I noticed we didn't have here was the bad, the bacon, the cheeseburger, the pizzas, the this, the that, all the things that taste the best, let's be honest. But that's okay, because we can do everything in moderation. But tell me about maybe some of the worst offenders that you see out there that you're like, we really should be cutting back on that.
Really fast food and fried food.
Oh, that's so hard.
And highly processed meats. You know, I know the bacon and the sausages are the tasty stuff, but those are the biggest offenders. And if we try to minimize a little bit of processed food, that would be really good.
Yeah, because also, like, it could be hard for some people to go cold turkey, saying, I'm never going to eat those things again. But you're saying if we just limit that even and mostly focus on this, then once in a while, it's not going to be so bad.
What I tell patients is that there's nothing you can have, and think about it as if you want to have a treat. This is sort of something occasional that you can have. It's okay, but it shouldn't be your sort of day-to-day diet. Try to focus on the healthy things.
Yeah, for sure. Okay, so if people have one takeaway here, or maybe the one change we should make, a small change, what would you suggest, like we start tomorrow?
I would say try to eat more vegetarian options. Try to eat a lot of leafy greens in your diet. Try to implement beans and nuts in your diet, and minimize the fatty stuff in the meat.
And the processed food, yeah, and the red meats. Oh boy. Okay, thank you so much for being here. We really appreciate it. I think some good takeaways for us on this Wellness Wednesday. Thank you for streaming Today in AZ on 12 Plus this morning.